have a classical Roux-en-Y gastric bypass, a classical sleeve which acts so well, a mini gastric bypass, a BPD which works so well, is there actually a need of doing a banded bypass or a banded sleeve? I had a pleasure to work with Dr. Phoebe, who is the inventor of Phoebe's ring for the gastric bypass and the sleeve, and it's a brilliant thing to use. I suddenly realized that the effectiveness of a sleeve gastrectomy or even a classical Roux-en-Y gastric bypass over a period of time does actually decrease. The restrictive component of the sleeve over a period of time decreases. The restrictive component of a gastric bypass decreases. So can we do something extra in these two procedures to make it a lifelong procedures? Yes, and the answer is Phoebe's ring or a banded sleeve or a banded gastric bypass. When you add a ring or when you add this Phoebe's ring to your bypass and to your sleeves, you are making sure that over a period of time, over the period of next 2 years, 4 years, 10 years, 15 years, 20 years, the pouch or the sleeve that you're going to make is not going to dilate, thereby keeping the restrictive element at a constant. As you will have realized, a classical Roux-en-Y gastric bypass over a period of time does lose its efficacy. Why? Primarily the roux limb or the limb or the intestine which is joined to the upper part of the pouch over a period of time gets adapted to the amount of food which goes in, the anastomosis. It anyway can absorb all the glucose, and the effectiveness slowly and slowly may decrease over a period of time. To keep the restrictive element alive, to keep the restrictive element to moderation, we could add a ring over it so that the restrictive element remains a constant and the malabsorptive or the metabolic component can stay. Similarly, in a sleeve gastrectomy, if you add a ring over a period of time, the dilatation of the sleeve would not happen. So over a period of time, we can have almost similar effects that we can achieve in the first 2 years and 3 years. But does it actually increases some more complication when we add the sleeve? Yes, around 1 to 2% there is a chance of band erosion, but that can be very easily tackled with an upper GI endoscopist and the ring can be removed. But look at the advantage that we get. The advantage of maintaining and retaining the effects that you get in the first 2 years for the next 5 years, 10 years, 15 years, 20 years. So, in patients, in people who are more than 40 BMI, younger age group, I would always suggest to add a ring to make them a prolonged restrictive element active in this subgroup of patients so that they can have a happy post-bariatric life.